All right. All right. Yes.
And are we also recording?
It will get saved to our YouTube channel.
Perfect. Excellent. Excited about that.
All right. We have started streaming.
All righty. So maybe like in one more minute, we can get going and get through the announcements pretty quickly since we have a meaty agenda. The sun is not giving me the little glow anymore. I'm like, what?
And Jen, I'm going to go ahead and start letting participants in as well.
Sure.
Cool.
Oh, you know what? Let me share my screen.
Okay.
You can let folks in and I'll share my screen in a second.
All righty.
All right. Okay, I'm gonna share. Okay, do you see the remote piece on top? Or no?
I don't know what you mean by remote piece. I see tonight's featured discussion.
Oh, I meant by, you know, like when you're sharing the screen on top. It gives you like the buttons of like stop sharing if you wanna. I just wanted to make sure that wasn't showing on top of the screen.
No, it's not.
No.
Okay, perfect. All right, we're at 6:30. We're just gonna give it a few welcome folks. Folks are still coming in. We're gonna give it a minute before we get started, but we're excited to share a lot of content with you today. So hope you're ready and feel free to turn on your screen because it's lovely to see your faces and it just makes it more real for us. Okay. Okay. Hi, welcome folks. We're just giving it a second for folks to get situated and on the call so we can get started. All right, I lost my chat somewhere, so give it one more minute and we'll get the ball rolling. We got to figure out the music thing to give you a little like vibe in the background. All righty, it's 6:32. Let's get the ball rolling. There's still some housekeeping things that I have to cover with you. So let's do that first. So welcome. This is On the Road to Recovery, the Alameda County Child Care Check-in. Today is October 14th, if you didn't know, because things are a little crazy in the world. And this is hosted by the Alameda County Emergency Child Care Response Team. And that team is comprised of 4Cs, Bananas, Hively, the Early Care and Education Planning Council, First Five Alameda, Social Services, Alameda County Office of Education, and Alameda County Public Health and Healthcare Services Agency. So just so you know who's behind the scenes and helping to put this together. A little bit of housekeeping. If you've been here before, you've seen this slide. We have interpretation available. If you need translation services in Spanish, click on the interpretation channel and switch to the channel that's most appropriate. We also have Mandarin available for others as well. And if you want English, you just stay right where you are. Okay, and that's the interpretation for Chinese. Just so that you know, this session is being recorded. It's also being live streamed. So one thing that, we did one registration for all 3 sessions this summer and fall, and we are at capacity. So we want to make sure that folks have access. So it's being shared through First Five's YouTube channel. You can find the content there later. We'll also follow up with an email. Currently, you're all muted just for, making this as seamless as possible and getting through the pieces. You can submit any questions that you have via chat. We have a lot of folks on the call this evening that you can share some info or ask some information about. Or when it's time for Q&A, we'll have a prompt from Q&A. You can unmute yourself and ask your question live. Just be mindful of your muting and unmuting. I really appreciate it. So the content for tonight's session is we're going to give a public health update. Lisa and Sabrina are here from Healthcare Services Agency to give you a little bit about what's new on that front. We have Karina from Child Care Law Center will give a little bit about vaccine mandates for staff. We'll give an update on provider stipends. Those have been going out the door. And then we have some announcements to share with you as well. And then as usual, more Q&A, and we'll close the evening with one another. These are our presenters this evening. So you can see their lovely faces when they start to share. You will know who you are looking for on your screen. Okay, first up is public health, COVID-19, and childcare guidance. I'm going to kick it off to Lisa and Sabrina to get us going. Welcome.
Hi, everybody. Lisa and I are so happy to be here with you. Again, my name is Sabrina Berger, and I'm part of a team that's done a lot of support work around COVID and childcare and schools with guidance and all kinds of things, including now some work around the vaccine. Just one thing to know, I'm a parent of a 4-year-old and in preschool for most of the pandemic. And I just want to start out first by, thanking you all for all the work that you have done and continue to do. I'll get emotional if I talk too much about it, but I just have gratitude for all that you guys have done. You've been working throughout this pandemic when, gave us and our kids just feel so much gratitude. So first off, thank you. We can go to the next slide, please. Okay. So we're going to just take a little bit of time to talk about kind of what's coming with vaccines for 5 to 11-year-olds. We're going to talk about the booster vaccines. Right now, Pfizer is what's available, although others are probably coming very quickly. And then talk a bit about kind of the complicated situation with COVID and those times when there's quality, and Lisa will take over at that point. Next slide, please. So I'm sorry. Was anyone, okay, sorry, I thought someone had something. So authorizations for the vaccine, there's multiple steps to that process. And right now, we're kind of in the beginning stage of authorization. So we're expecting the FDA is going to meet later this month on October 26th to review the emergency use authorization. Then it will go to the CDC, which again, we expect to happen around early November. And our hope the recommendations will come out for providers to begin to administer the vaccine at the latest on November 3rd. So we're all really hoping that that's coming soon. Just one thing that is important to note is that the dosage will be different with this Pfizer vaccine than it has been for all the other vaccines, vaccine age groups. And one reason that that's important is because it's going to kind of the timeline. So it means that even once authorization happens, there's still going to be a little bit of a delay for them to be able to kind of have the dosage ready to be administered. So that is just something to kind of keep in mind. The other thing we did want to just kind of remind all of you is to start to think about how your programs might be.
I'm sorry, I don't hear what you're saying. I think you mute yourself.
Looks like Sabrina might be frozen.
Yeah, Sabrina, I think you have it might be her internet. She said that she was having Wi-Fi issues.
But
So,
there are always Wi-Fi issues.
Oh, you're back, Sabrina.
I'm so sorry, you guys. I'm so sorry. Technology. Where did I lose you?
You were about talking, starting with the last bullet, Sabrina, the reminder.
Okay. Yeah. So once kids are fully vaccinated, really once anybody is fully vaccinated, they no longer have to quarantine if they've had an exposure to COVID-19. So the way that could impact your program is that more likely than not now, a child in your program has COVID-19. The entire class or cohort will quarantine, right? Because they're all close contacts, they're all going to go into quarantine. But once you have a mixed sort of vaccinated and unvaccinated population within a cohort, those that are fully vaccinated no longer have to quarantine. And so that means that programs should really be spent to accommodate for those students who are fully quarantined, who are fully vaccinated that no longer have to quarantine. So it's just sort of a change that is coming kind of in the future. Next slide, please. So we know that there's been, boosters are now available. And we just wanted to share a bit about who's eligible for that. There's sort of two categories around the boosters, and one is really recommends who they really think should be getting boosters, and then there's those who may receive booster shots. And within this category, you'll see individuals 60 years or older, residents who are living in long-term care facilities, those who are 50 to 64 with underlying medical conditions or increased risk due to social inequalities, right? So those are really who the CDC is saying after 6 months of a Pfizer COVID vaccine, you should receive a booster shot, right, for your own safety and health and well-being. There's another subcategory, which most of you should all fall into, which is those who may receive the vaccine, right, who qualify for the booster. And I'm going to kind of, if you don't mind, Jen, going ahead to the next slide, because what's most important about that category is that it really is looking at eligibility in terms of occupation or jobs. And I did, bold the daycare workers, right? So all of you would fall into that category. You are eligible for the Pfizer booster, right? So if you received Moderna or J&J, those aren't yet approved, although they should be approved very, very shortly. But those who received Pfizer are now eligible for boosters within these sectors. And, of course, like you can always consult with your health provider if you're not sure, you should be getting it, or if you want to get it. As always, be in contact with your medical provider around these issues. Next slide, please. So also just kind of where to get boosters, you all will receive this PowerPoint, but My Turn has been a site that is the state runs. It's been kind of around since the beginning of the vaccine rollout. That's certainly a way that you can find locations near you for where you could receive the booster. Of course, always checking with your healthcare provider or local pharmacies in your area. One thing just to know is that you don't need to sort of prove that you're eligible, right? It's basically you're saying, yes, I fit into these categories and therefore able to get a booster. And then I think, as I said before, the FDA is in the process of sort of moving along, the Moderna and the J&J being passed very soon. And just the last thing to say is the county also does do a lot of vaccine efforts, but right now the focus kind of continues to be around getting unvaccinated folks vaccinated. So focused on boosters because we're really, really focused on making sure that we're getting all of those folks who are unvaccinated to be vaccinated. Next slide. I think that's the end of my portion. Thank you all so much. I'm going to pass it over to Lisa.
Thank you, Sabrina. That was great. Very informative information. I don't have many slides to share with you all. I'm just going to do a quick overview, and hopefully we won't have to worry about this because I did hear there was some rain coming next week. So let's pray that that rain happens and maybe our fire season will be over. Fingers crossed. But I did want to point you to some resources and talk to you a little bit about what happens when the air quality is unhealthy outside. And then we're going to show you where some resources are so you can kind of learn a little bit more. Next slide, please. So this is a chart, and this we're developing some guidance right now where this chart will be included in the guidance so you can access it there as well. But it shows you kind of, at what point should you bring your activities inside, and maybe some of the activities, or maybe stop doing like high intensity activities outside. And then at what point do you need to move everything inside? So that's right down at the bottom where you see that purple flag. That's when it's very unhealthy. And that's when all of your activities should move indoors. And the reason for this is especially with children, they're more susceptible to asthma, and they are just more susceptible to the poor air quality. So it's very important to make sure that they are inside when conditions outside are unhealthy. Next slide, please. Let's see. And so basically the two strategies that you need to use for addressing indoor air quality. So when the air is purple, when you're in that purple category, you need to bring the kids inside and you aren't able to open windows and do the usual things that you do. These are the two strategies that you need to use. So one is ventilation and filtration. So it's making sure that you have your air conditioning systems set up and that they're they have the right, what do you call it? There's a word that I'm thinking of, that you have them set on the right, not frequency, sorry. There's things that you can do to your HVAC system to have the air circulate in the right way. And it can get a little bit technical, and I'm not going to go into all the technicalities around that. But you need to make sure that the air is circulating in the right way so that you don't have the smoky air coming into your indoor, classrooms. And like I said, we have a longer ventilation guidance document, and you can, access that and use that to determine how to set up your HVAC systems so that they're filtering in the correct way. The other thing to do if you don't have an HVAC system is to set up a clean room. So you create a clean room, and that's where you use a room air cleaner, a HEPA filter, they're also called. And we have some resources for you to determine what kind of a HEPA filter you might need for your particular space. So I can show you some of those resources as well. Next slide, please. And they might be in the resource slide. That might be the last slide. Oh, okay, no. And of course, you're going to want to think about communication with your parents and caregivers. So when you move your program fully indoors, you want to make sure that families know about this, and that if parent and caregivers, want to arrange for a different alternative for their care, they have the choice to do that. And then the facility also sometimes may have to close during very unhealthy outdoor days. Next slide, please. Okay, and so I want to show you, there's two documents here where it says the Google Drive right here. Jen, do you mind clicking on one of those? I'm not going to go through it, but I just want to show. Thank you. This should be the tip sheet, I think. Yeah, so sorry, my dog is barking in the background. I apologize for that. So this is a tip sheet, and this helps you calculate, what kind of a HEPA filter you need for the size of your room. So it's a pretty easy one pager here. I'm not going to go through it, but I just wanted you to know that this is here for you. And then there's another tip sheet right below the other one that's a little bit longer that goes into more description around that. Just wanted to show it to you. And here's another one here. And as I mentioned, we are developing a much longer one that even has more technical information in it about HVAC systems and everything related to ventilation. And that one will be final probably sometime next week. And then we'll need to get that translated as well. So we'll be sure to let you know when that's available. I think that's all. Thank you.
There's just one more slide with additional resources.
Oh, great. Yeah, so let me just point out as well, this is our school and childcare page at the Alameda County Public Health Department. I'm sure many of you have already visited this page, but this is where we keep all of our updated guidance. And we have someone that we're working with right now who's going to be working on a toolkit for childcare. So we know that there aren't enough resources and guidance tools for childcare. So we're really excited to have someone that's dedicating her time just to help all of the providers to continue to navigate this recovery through hopefully the end of the pandemic, or toward the end of the pandemic. We're hoping. Let's see. That's it.
And now that is it. So now we have Q&A, and I see that Mirza still has her hand up. Do you want to unmute yourself and ask a question? Mirza?
No, estoy bien, estoy escuchando,
Oh, okay, está bien. Is there anyone else who would like to ask a question to Lisa or Sabrina on what they presented on the guidance of the upcoming vaccinations, boosters, air quality?
You can actually ask any question related to public health, or any question, really.
I do have a question.
So Flora, you said she got.
So if I got my vaccine on March and it's already 6 months, I just need to call my health provider and ask for the boost of the third dose of the vaccine. I got Pfizer.
Yeah, if you got Pfizer, you actually don't call your healthcare provider. You could go to a local pharmacy. You could look on to find kind of a location close by. You absolutely could go through your healthcare provider if you would like or feel more comfortable, but you don't have to. You're eligible to go anywhere to get that booster.
So I have a same question because I
Thank you.
was a little bit late. It's the same question. So as a childcare provider, we can just show our the previous the card, the vaccine card, and then show we're already past the 6 months, and then we can get the booster anytime. That's what you mean? Is that what you mean?
Yes, that's right. You are eligible because, I mean, many of you may be eligible for a variety of reasons, but at a minimum, you're eligible as childcare provider for the booster for Pfizer if it's been 6 months since your second dose.
So, but how could I provide it? So if I go anywhere, so what are we gonna say? So we're gonna say I'm the childcare provider. I'm the director of the childcare center. So which document should we bring to there to identify we are the childcare provider?
My understanding, and Lisa, you can correct me if I'm wrong, but that it's just based on your word. You don't have to show any documentation, as really has been the case with vaccines in general. So it's something called self-attestation, which just means that you are you are confirming that the information you're giving them is correct. And the information you're giving them is that you are a childcare provider and therefore you are entitled to a booster. And that's all you need to provide. You don't have to provide any other documentation.
So, so I just go, right? I just go anywhere and then just say, okay,
Yep,
anytime
that's right.
from
Yeah.
today.
That's
Yes,
right.
if it's been 6 months, and yeah, absolutely.
Thank you.
Yeah, you're welcome.
I'm sorry, I do have
Yo
another
tengo una
question.
pregunta, soy Olga.
Excuse me.
Entré tarde, perdón, no me acordé de la reunión. Creo que no haber oído toda la información, pero ¿es obligación ponerse el refuerzo o es opción de cada una?
Es opción. So lo que voy a hacer, what I'm gonna do is we have 2 people with their hands up and then there are a list of questions in the chat. So what I'm gonna do is take those 2 questions. Kim, if you can, right after that, just run through the questions that are in the chat. And then we are likely gonna wrap up on the, by 7, hopefully. If not earlier. And then if there are other questions, we'll return to that a little bit later just to make sure our other presenters have enough time, okay? So Elizabeth, Lisa, and then we'll go to the chat. Elizabeth?
Yes, I have a question for you. As far as when parents are traveling, I've been reading different things from the CDC, so I kind of want to get this clear. I know if you're vaccinated, you're pretty much good to go if you travel and you're coming back to school. Do you know the specific requirements for parents and children that are traveling? They're unvaccinated, of course, because they're kids coming back to school. Are they supposed to quarantine? Because I'm reading some places where it's saying 14 days, some places where it's saying 7 days. I'm just getting a lot of different information. So I kind of want to get a specific of what are the requirements if they are traveling.
Yeah. So at this point, we follow the CDC's guidance on travel for unvaccinated populations. And that says it's a recommendation. It's not a requirement, although as a program, you could choose to make it a requirement. But the recommendation is that upon return from travel, testing happens 3 to 5 days after travel. And that you continue to quarantine for a full 7 days with a release on day 8, assuming that you have no symptoms and the test has been negative. And I noticed that Lisa just put in the chat the guidance. So you're welcome to look through that. I will also say, and I'll put this in the chat, we have a line that myself and a colleague and Lisa respond to every day, all the time. That's questions just like this. Related to guidance, related to support for positive cases. Oh, and Lisa put it in the chat. So it's safe learning at acgov.org. Okay.
Thank you so much. Thank you. Thank you.
Hi, everybody. Thanks for doing this call again. Appreciate it. I just want to make a quick statement on the boosters. I got my second boost. I got my 3rd shot 3 weeks ago, and it really is that simple. You can do a walk-in to Safeway. That's what I did. I walked into Safeway. All I had to do was show my card that they gave you when you got your other shots and that you got Pfizer, and it was 6 months, and you didn't have to show proof of daycare provider or anything. So don't stress about it because it really is that simple. Just go and get it.
Thanks so much for sharing that.
Okay, so from the chat, hi Giselle. She asked, at what AQI would you suggest children stay home? What is considered really bad air quality?
So if we could go back to that chart, Jen, do you mind? Do you have controls? Just to show you the purple, and everybody knows you can access on the internet, you can find in your neighborhood what the AQI is by using certain apps on your phone or going on the internet. You should be able to find that. So I just wanted to let you know that. And down here, you'll see purple, where it's purple, and the AQI, it's hard to see. It's a little small in this particular slide. 200 or higher, so 201 or higher is that's when they recommend that all activities should be moved indoors. We don't have a recommendation necessarily for when you would close your program, but you may choose, that's kind of up to you when you choose to close, based on, the feasibility of moving everything indoors and how that would work for your program. But that's kind of like considered very unhealthy air quality would be over 200, and unhealthy is 150, between 150 and 200. So that's when you should start, thinking about, less intense activities, bringing some, kids with asthma or higher risk indoors. So you want to consider, the red and the purple are where you should be concerned. But we don't really have a recommendation for closure.
Thank you, Lisa. And to emphasize what she mentioned, if you have an iPhone, I know for sure, if you just go to the weather app and you scroll down, it will tell you very plainly what the AQI is, and it's color coded. So
yes, thank you, Kim.
Okay, so we have a question from Sue. She wants to know, is there a mandate yet for childcare providers to be vaccinated for COVID?
There is not a mandate. I believe that that's part of why we're having the speaker from the Law Center come on, is to sort of talk about the legality, if programs were to mandate it, but there is not a state mandate for childcare providers at this time.
There is a mandate in Berkeley. So there's a city, but you're right, Sabrina. Just wanted to mention that because some providers here might be from Berkeley.
Thank you. We have a question from Catherine. She asks, if a child's family member has tested positive, but the enrolled child tested negative, is there an action the school needs to do to notify the cohort and/or safe learning?
Yeah, so great. This is an example of something where we kind of field on safe learning all the time. Child would need to be quarantining, and ideally they're quarantining separate and apart from the family member who is positive. That family member who's positive is truly able to isolate, because that means it can actually be a quarantine. And I'm not going to get into the logistics about what happens if they're not able to. That would absolutely be something to reach out to us for safe learning about. It's complicated. But the only really action for your program is that child needs to be quarantining. And obviously, if anything were to change, if you find out that exposure symptoms of that child, or they test positive for COVID, then absolutely there would be steps the program would have to take. But a family member being positive and the child being exposed is not a reason to have to close program or quarantine anyone else in their cohort.
Thank you. And the other questions I believe we've answered. One was from Catherine about travel outside of California and what was recommended. Lisa provided a link in the chat for the CDC travel recommendations. And then there was another question also about whether vaccines are mandatory for all educators and by what date. What happens if you do not get the vaccine by the due date?
All righty. Appreciate that, Kim, for facilitating those questions. If you have others, feel free to chat. I welcome Kim's monitoring the chat. But if Lisa and Sabrina want to just check it out just in case there are additional, that'd be great. I'm going to move us along onto our other guest presenter. And Karina, I hope I don't butcher your name, but Karina Ligo from the Child Care Law Center has joined us. Yay! Has joined us this evening. She's going to share a little bit of information related to mandates on vaccinations. So Karina.
Thank you so much, Jennifer, and you said it exactly correct. Good evening, everyone. I hope you are all doing well, and thank you for your time joining us. My name is Karina Ligo, and I am a staff attorney for the Child Care Law Center. Tonight, I will be briefly discussing vaccination requirements for employees. And like Jennifer said, we've built some time in for questions and answers, and I will attempt to answer one or two. But since many situations are fact specific, it would be better for providers who have questions to submit them to our intake and referral system on our website or follow up via email with me. And I'll throw my email in the chat at the end of my presentation. Next slide, please. So this is a legal disclaimer that states it is important that the information does not and is not intended to create an attorney-client relationship between you and the Child Care Law Center or in rendering legal or other professional advice. If you need legal advice or assistance, please contact an attorney directly. You can find help through contacting the State Bar of California to use their lawyer referral service with the telephone toll-free number provided. The State Bar also has a directory of the lawyer referral service for each county bar association. Next slide, please. Thank you. So this is mandating vaccinations. Like you was stated earlier and in the chat, there's no federal, state law, nor community care licensing requirement that requires providers or their staff to be vaccinated against COVID-19. However, providers can mandate their staff to get it. There's already established law that requires providers, staff, and volunteers to get certain vaccinations. People who work or volunteer at childcare homes and centers must be vaccinated against the flu, pertussis, or the measles as required by the California Health and Safety Code. The COVID-19 vaccine is not on the list of required vaccinations, but it might be added in the future. Additionally, providers have a duty to create a safe environment for children and employees. Childcare providers must ensure children are accorded safe, healthful, and comfortable accommodations according to Title 22 regulations. Under us to make and maintain a safe and healthy place of employment. Employers must make an injury and illness prevention program, IIPP, to protect employees. The plan is to protect employees from hazards in the workplace like COVID-19. Employers were given guidelines on how to update their IIPPs to include preventing COVID-19 spread. One way of creating a safe environment is to ask employees to get vaccinated against COVID-19 on top of the other preventative measures, like regular cleaning and disinfection, wearing masks indoors, and hand washing. However, a provider cannot automatically terminate an employee if they refuse to get the vaccine because the refusal may be based on a federally or state protected characteristic. If it is, the provider must consider whether the requested exemption would be a reasonable accommodation necessary to prevent discrimination against that employee. A requested exemption is not reasonable if it would, 1, impose an undue hardship on the provider, or 2, prevent the employee from performing essential duties without posing a direct threat to the health and safety of the employee and others. Providers must look at the specific facts of each individual situation. If an exemption would not be reasonable, the provider must consider whether alternatives such as on-site safeguards, changes in work practices, or job restructuring would reasonably accommodate the employee. Only if there is no reasonable accommodation that would allow the employee with a protected reason for refusing vaccination to perform essential functions safely and without imposing an undue burden can the provider exclude the employee. Next slide. Oh, sorry, my bad. Still in the same, sorry. Potential exemptions to the vaccination mandate. The first is a disability-related exemption. If employees assert that a medical condition or disability would make getting the vaccine dangerous or inappropriate for them, then the employer must engage in a good faith interactive process. During that process, the employer may require documentation showing the need for the exemption as an accommodation. Pregnancy-related reasons are treated the same as other medical conditions or disability for these purposes. The fact of pregnancy is not on its own a sufficient reason for exemption. The CDC has indicated that vaccination is safe for pregnant women and on September 29, 2021, issued an emergency alert for urgent action to increase vaccination among pregnant women. The second is a religious belief exemption. Some employers may object to vaccines on religious grounds. Title VII of the 1964 Civil Rights Act requires employers to reasonably accommodate an employee's sincerely held religious belief, practice, or observance. As with disability, this is only if the accommodation can be made without undue hardship to the employer's business or posing a direct threat to health and safety. The EEOC, the U.S. Equal Employment Opportunity Commission guidelines and court rulings take a broad definition of religion, including, quote, moral or ethical beliefs as to what is right and wrong, end quote, that are held by the believer with the same sincerity as traditional religions. The California Department of Fair Employment and Housing has clarified in guidance that it does not consider that someone who does not, quote, trust the vaccine is safe, end quote, or questions the wisdom of a mandate among protected religious beliefs. If a staff person does not have a reason why they are refusing to get the vaccine, try to have a conversation about why they don't want to get it. There is case law going back more than a century upholding vaccination mandates by states who are subject to more scrutiny than employers. For example, Jacobson versus Massachusetts. Courts have shown little patience with the numerous amount of cases filed around the country challenging COVID vaccination mandates by employers, and in the small in in which plaintiffs have obtained relief, it generally had to do with the lack of any kind of exemptions, particularly religious exemptions. However, if you are considering firing someone for refusing to get vaccinated, you may wish to consult with an employment law attorney. Accommodation requirements. If the employee refuses because of a disability or medical condition under the Americans with Disabilities Act, the employer must try to accommodate the employee unless it would pose an undue hardship. An undue hardship, as defined by federal law, in general means a significant difficulty or expense incurred by the employer when it considered in light of certain factors, including cost and business employer type. When an employee requests a medical exemption from the vaccine, the employer must document and engage in a good faith interactive process with the employee. An interactive process is a conversation about what accommodation the employee needs to continue working. You may request verification from a medical professional that the employee has a disability or medical condition and documentation to show the employee's need for the accommodation. If you are having any of these legal issues or questions about these issues, again, please consult an employment attorney. Medical privacy for providers and their employees. Federal and California state law protects an individual's protected health information. California state law requires that employers who receive medical information must establish appropriate procedures to ensure the confidentiality and protection from unauthorized use and disclosure of that information. This means that if an employer gets information from their employees regarding the vaccination, the employer must protect the information and prevent it from being shared without permission. No employer shall use, disclose, or knowingly permit its employees or agents to use or disclose medical information about employees. That information can only be revealed if an employee signs an authorization. A provider has a choice to let a parent know if they themselves have been vaccinated, but a provider must get written permission to reveal their employee's vaccination status. If the employee gives employer permission to disclose their vaccination status, their authorization must comply with state law requirements. Next slide. Thank you. Vaccination policies. As every workplace is different, it would be best to contact an employment attorney directly when creating a vaccine policy. The suggestions that are listed here were pulled from Public Counsel's COVID-19 Workplace Vaccination FAQ for California employers. It may be helpful to explain to your staff the importance of everyone getting vaccinated to protect themselves, their families, and the families in care. Additionally, include the legally recognized exemptions to vaccinations, the clear steps for how employees can access accommodations, and that while an accommodation can be requested, if it is an undue burden, it may not be given. Providers who require employees to get the vaccine may find it useful to have a standard change to rule, like requiring employees to show weekly proof of a negative COVID-19 test result to offer their staff who cannot meet the vaccination requirement for a protected reason. Next, give your employees a date by which they should be vaccinated to make it easier for all to plan accordingly. The due date should include the time it takes to get both shots and the time period after until the employee is considered fully vaccinated. Also, Employers should let their staff know that their medical information is private and will not be revealed to anyone without their written permission. Further, employers should have clear rules about what to do if an employee exhibits COVID-19 symptoms. Finally, if an employer mandates the vaccine, the employer must pay for the time taken by employees to get the vaccination, including travel time. This is because the employee is completing this action as part of their job. And if we go to the next slide, I've included resources from Child Care Law Center, Public Counsel, the Department of Fair Employment and Housing, the Department of Industrial Relations. The first resources are frequently asked questions, where a lot of this information was pulled from. The second is our intake and referral form for more specific information. The next slide, or the next resource is the vaccine policy from Public Counsel, and the last two are from public agencies that have useful resources and information about what laws apply to employers regarding vaccine mandates. And on the last slide, if we could switch to it, please, we have other childcare updates. So we wanted to include an update with SB 234 that the fire marshal guidance has finally been released, and you can visit our website for more information about the new guidance. If you have any question about the guidance, please contact us. Additionally, we wanted to bring light to the ERAP program. And so if you have any questions about this program, you can call the call center or visit housingiskey.com. And I'm going to insert a couple flyers in English, Spanish, and Chinese in the chat that conveys this information. Thank you so much for putting up with a lot of that information. I know it was a deluge of knowledge.
Thank you so much, Karina, for sharing. And you can feel free to share those flyers with me as well. We're going to send out a packet of information with all the information that's been shared this evening to all our attendees. Okay, Kim, do you want to ask some of the questions that are in the chat?
Sure. We have a question from Carmen. I want to know if we can ask parents to prove vaccinations, or I think it means to prove they've been vaccinated. Parents get positive and then they report to you until they get results.
So we just updated frequently asked questions regarding this. So a provider, sorry, is the question to ask for proof or to ask them to get vaccinated?
No, the question is, I want to know if we can ask parents to prove they've been vaccinated.
Okay. So I think, I'm going to say by asking to, so a child care provider is a private business, and so they can require proof of vaccination like a bar or a store that starts requiring it, or a venue. But the child care provider also has to be aware of that they are subject to disability law, like the American with Disabilities Act and other state and federal protections. So if they're asking for proof of vaccination, they have to be aware that there may be exceptions to asking for that might trigger disability law protections.
Thank you. We have a question from Ebba, and it says, would parents who volunteer in classrooms be considered an employee with regards to COVID vaccine requirements? Volunteers already have to prove negative TB test and provide proof of measles and pertussis vaccines like an employee.
That's actually a very good question. We haven't had someone ask that, so I don't have an answer prepared for you, but I can bring that back to my team, and we'll circle back with Jennifer once we figure out a useful answer. Because the difference between employees and a volunteer, I'm sure you all know, is that you're paying the employee for their time, for their work for you. So thank you for bringing that question. I'll bring it back.
Yeah, you can go into the chat and just copy that. It's a chat around 7:07 p.m. if you want to scroll down. So much. We have a question that was answered in the chat, but I know everyone's not reading that. The question is, let's see. No, I think that was a statement. It was about in K-12, volunteers can be required to show proof of vaccination but that's not the case in childcare. So that was a statement from Sabrina. Thank you. I think, Pooja, I think your question was answered, and I know we answered that earlier, so maybe you just come on. I think
I
so.
think a question from Giselle. Oh, sorry, Kim.
Go ahead.
Giselle's question, can parents insist that a family childcare provider and or their family member get vaccinated? Again, I don't know that answer to that question off the top of my head, but when I think about it, a parent can choose where their child goes to childcare for parent choice. So I would think that they could ask, but I don't know if it'd be mandated. Again, I don't know. This is a very interesting question. I'll bring that back to my team as well. Thank you so much for your patience with me, since I don't know all of these answers offhand.
Well, thank you. And that was it, Jen, for questions.
Awesome. Thank you. Thank you, Kim, for monitoring that. And thank you, Karina, for sharing. And it's okay that we don't have all the answers, because it's just, everything is new. So it's best to get the right answer before we share any information with folks. So thank you for that. We'll make sure to be connected. And again, once I hear from her, we'll find a method to get that information shared out with you as well. And just a note for Rowena, if you can also save the chat, that might help with doing some follow-up as well. Thank you. Okay, so now, we talked about all the guidance and all the legality stuff, and now it's show me the money. Some of you may have already received it. I'm going to kick it off to our lovely Renee Hertzfeld from 4Cs to give us a little bit of an update and field any questions around that.
Okay, we have had a lot of good information, and I will try to be brief. We wanted to share some information on the most recent
Oh no, did she freeze for y'all?
Yeah, she did.
Sleeping between us.
So I think what she was wanting to tell you here is all the stipends that have been allocated and when they should have been received by the providers, and under what conditions you would have received them. So there was a stipend that was authorized with Assembly Bill 82 for $525 per subsidized child served in the month of November 2020. So all licensed FCCs and licensed exempt providers were eligible for that. And then there was a stipend for AB 3131, which was $600, same type of criteria. And that was in September 2021. And then there was the most recent one is the licensed child care facility stabilization stipend. And that was a flat rate depending on the type of setting you're operating in. And that was just recently. So, and there was a registration process for that. So hopefully everyone who was qualified and eligible to receive a stipend did receive one. And I think that's, I don't know if there's another slide.
No, this is the only slide, but what I will add is two things. One is that just a notification that this is taxable income. So it will need to be reported. Two, you need to fill out if folks mute themselves, that would be great. You have to fill out the survey if you receive any federal funds. It's a requirement federally, and the state is requiring you to fill out the survey, whether you receive one or all. Make sure you fill that out. They will ultimately circle back with you to make sure that that's filled out in one way, shape, or form. So just be on the lookout. You can, again, these slides will be sent out. You can click on that link. You probably also received an email either from the state itself or from the Resource and Referral Agency with kind of like the highlight for it. So plenty of those there.
There was a comment from Sherry in the chat that she only received the most recent one and not the earlier two. So please reach out to the organization that you get your subsidy payments from. So that could be Bananas or 4Cs or Hively, Davis Street possibly as well. So contact them and to find out.
Yeah, the state also has a webpage that you can kind of follow along of where they are with all of the stipends and any questions that you might have related to that. Yes, ma'am. So since you're registered, you will be one of the folks who will receive all of the items, Ms. Anika. Okay, if there are no other questions related to the stipends, we'll keep moving because we're getting close to time. So hold on one second.
Yeah, I have a question about stipend. So we already received one check from the stipend, but I don't know if your previous part the slide is the showing is the different one or the additional stipend were because you said there's specific license who are retained the child care license in, so we are qualified for 3 of them. So we were since day one of the shelter in place were open even in November 2020. So is there any extra stipend I can apply or just a one-time stipend? I don't really understand.
So just like Kim just mentioned, reach out the contact information for the R&Rs, or if maybe it's Davis Street that might be providing your provider payment. You can reach out to them and they can look into the distribution of that stipend.
So who I should to contact? I don't really know the person you were mentioning.
They're agencies. So if you receive payment for subsidized children through 4Cs, Bananas, Hively, Davis Street, you could contact the agency.
And also there is the category I received the email say if you are provide the child care for the special needs, there is the extra. Is that the same stipend or the extra stipend? I don't know. We got one. We already got one. The recently last 2 weeks ago.
Yeah, there's no number to call. The number you would call is the agency that services your area. There's a slide later on for that. And in that contact information, you can reach out and we'll work to connect you in whatever way that we can. We don't get a list of who's received stipend or where they went or that sort of thing. The agencies that they've sent out and the such.
Okay, got it. Thank you.
Okay, no problem. And yes, the stipends that went out are for those who are supporting subsidized children. We know that there are challenges with that. Not every childcare provider supports subsidized children for various reasons. So these released by the state and using federal funds went to those caring for those with subsidies.
I am back. I'm so sorry. Electricity is not my friend today. But I'm sure you guys answered all the questions well, and we did say that the ones, that very first one on the top, that's for any licensed provider, whether they cared for subsidized children or not. You just had to have a license as of June 25th, 2021. And that's the one that would not be issued by our AP programs, but it would be issued by the Black Hawk Network.
Thank you for that, Renee, and no worries, we're in retrograde, so I expect all of the things that are happening. We're getting close to time, so I wanna make sure that we get to one piece real quickly. Again, the recording will be sent out. There will be, First Five will host the recording on their YouTube website. So you can find that there. Again, we'll email out all that you've seen today. And no, they're not for any provider. It's the ones that are serving, if you see issue 2, children on subsidies. So those are the, for the way that the state has distributed these funds, that's how that goes. I will move on to the next slide. Okay, announcements. So just really quickly, our local planning council has several vacancies available. There's about 5, so all districts essentially, if you are interested, applications are being accepted until October 31st. Again, this link it'll be provided with the materials. You can go also on the acgov.org/ECE. There's a link to the application there. It's pretty short and sweet. So if you are interested, please go out and fill out an application. We're looking for folks. I'm also an LPC member. Okay, so this came out just this afternoon. We have also Nika Evans from our Tucker licensing division on here. There are a number of webinars that will be hosted. Here are the times. This is the PIN number. Please make sure you register for those. Nika, do you want to share any information with the folks here?
Good evening to everybody. And just as the slide says here, these are our new dates for our local licensing calls. You can get on any of the calls. The same information will be relayed. Our child care advocates will pretty much do the presentation, but we will have staff from your local licensing offices on. I'm not sure which one Oakland or Oakland Southeast is hosting. I know it's one of them. As she stated, the PIN just came out this afternoon. And so sometimes it's a surprise to us as well. So I do encourage you to look at our website, which is www.ccld.ca.
Do we have another one, huh?
Tonight's our night.
Okay, can you guys hear me? Uh-oh.
Yeah. Yeah. Oh, she went out again. Okay, so hopefully, she did post their webpage in the chat. We'll add that as a link. I think you all know how to get in contact with your community care licensing division. Lots of questions there always. And if you have questions for Anika, feel free to put them in the chat as well. I know we've had a lot of questions from for licensing. This is your local resource and referral agency. Davis Street is an alternative payment agency, but so are the R&Rs. But connecting with them, we're all one big group and team, and we work with one another. So we'll pass the message to get you all served. I will note that our final check-in, what we've scheduled, is up in December 2nd, same time, same bat channel. If you registered for the first one, you are already registered for the other one. We had a little bit of an issue where we've reached capacity because if you registered one, you registered for all. So, but there's a fragment of, those numbers represented tonight. So we'll continue to have a workaround just like tonight. We're having it live on the YouTube channel and the recording will also be available. So I saw a question in the chat, how you'll get the materials. If you registered, an email will go out. If we're not unable to register, we can get it sent out. We'll work with the R&R's agencies to send it out through their newsletter, potentially. So, more to come on that. You can always reach out to us. Thank you, Anika. Anissa was my former supervisor. So, Lisa, Karina, Sabrina, Kim, Renee, Rowena, the whole team, thank you so much for all your work and support this evening and sharing valuable information. I love to be on time and we are past time. That's nuts. We will be coming back and sharing more information with you on December 2nd. Those RMR rates will be increasing starting January 2022. So we want to make sure that we give you whatever updates are available. We love you. We appreciate you. And thank you for joining us this evening. I bid you adieu, and I'll see you out in these streets one of these days. Farewell, folks. Have a good night.
Good night, everybody.
Thank you so much for all your information and guidance. We so much appreciate it. Lisa, it was wonderful seeing you.
Bye.